by September, we will know what has caused the autism epidemic.
I think we found an answer to autism.
The FDA will be updating the label of an existing drug to reflect potential benefits in reducing some autism symptoms.
Up to 60% of folate deficient children with ASD can have improved verbal communications if given leucovorin.
It seemed like a breakthrough to finally hear an administration tackle the growing autism numbers in America. Today, for those of you who don't know, is Autism Awareness Day. And perhaps, sadly, maybe even predictably, much has not really changed in September, except, of course, in the numbers of people diagnosed with autism. When I was diagnosed with what we now know to be autism, it was about 1 in 1,000 kids. Now it's 1 in 31, 3 times higher for boys, higher still in poor minority communities, because the numbers keep rising. But today, despite the promises, there are really not a lot of new answers. As you know, this is personal for me. I wrote a book about growing up with autism called Born Lucky, about how my father dedicated himself to adapting me to the world, not the world to me. My wife would argue it's still a work in progress. Diana Diaz is here, National Autism Coordinator at the Department of Health and Human Services. Thank you. Welcome. An autism mom yourself. Am I wrong to think that since September, this seems to have kind of disappeared from the conversation?
Likely, but the narrative is back. I have joined the administration as National Autism Coordinator. My goal for today was to have such a positive celebration of the resilience, the tenacity, the ingenuity that the autism community has. And I think today we accomplished that at HHS. We hosted families from around the country who are trailblazers in their communities, creating solutions. And we're excited for the path forward. We're coming up on a year of the National Autism Science Data Project. And
so help me understand, though, what since September do we know, and this has been something I've been very passionate about, now outspoken about the need to find the cause of the explosion in cases? Are we closer?
I think we are closer. The data sets that are being studied are massive. Like I said, we're coming up on a year of that unprecedented $50 million investment. And the data is going to become available. It's going to be summarized, available to the public, and we can see the interplay of genetic predisposition and what environmental triggers are causing the most issues, the higher prevalences in some areas. And with this era of radical transparency, these data sets are going to be available to the public. That's part of my role, would be engaging with the community to help them put the research into practice by making lifestyle choices and changes that could really improve their children's life.
It's a great point. There has been this debate over whether we should even be having this conversation, right? And one of the points that I talk about in my interviews about Born Lucky is Chris Hayes, who has been outspoken about your boss, Robert F. Kennedy. Take a listen.
One of the things that's been very strange to me about watching the development of the perversion of the public health system under RFK is the obsession with autism. So it's like it's on both ends, and that autism is this like creeping specter that's, you know, this society is awash in it, but it has become this strange, I think, strange kind of obsession.
My question is, forget the dripping arrogance, why we would not be obsessed with finding a cause, and what the hope would be for parents, not necessarily of kids who have autism, but for someone like me who will be a future parent, of what we may or may not know about what causes it.
I think the secretary is right on point. He is leaving no stone unturned in really trying to find the causes, the combination of genetics and environmental triggers that have caused the higher prevalence. As the top leader in public health, of course, it makes total sense that we would be wanting to know the causes, because it is something that is affecting society, it's affecting healthcare, school systems. We autism parents are worried about the future. And so it is something that is worth focusing on. And because it's part of the larger chronic disease epidemic, it's part of a more holistic agenda to find out what are the causes and what we can do, what is at our disposal to perhaps reverse the difficulties with it.
Thank you for watching. Subscribe below and download our NewsNation app right now on your phone, and you will get fact-based, unbiased news for all Americans.